you got? Do you recommend lymphatic drainage massage after a tummy tuck? If so, how soon after and how often? Good one, Nicola. That's a good one. I would say I don't know. I don't know. People talk about it and they say it's good. And I could imagine it being so. Do I recommend it? So answer the question, do I recommend it? No. I don't not recommend it, but I don't say routinely to my patients, you got to have lymphatic drainage massage. And that might be because we haven't got a link with a practitioner. I don't know if there's any evidence to say there's any long-term benefit in it. There might be a short-term benefit in it. And I can imagine that it is quite nice to see someone and to have some kind of treatment. I don't want to belittle lymphatic drainage massage people to say that they don't have any effect, because I'm not saying they don't, but I think the fact that you're just seeing someone and they're kind of laying hands on you, I don't think we should underestimate that benefit. But I'm not sure if there's any scientific evidence for the long-term benefits of it. Short-term, maybe there's some short-term benefits in terms of swelling. So I've got no problem with it. And if someone says to me, should I have or can I have it, I'd be like, yeah, go for it. Let me know how you get on. For sure. I don't think there's any harm in it, put it like that. I mean, obviously you have to pay for it, so there's that element. How soon after and how often? That's the people who provide the treatment have varying opinions on that. But I think there's something to be said for straight away. Day one, day two. Obviously, it's going to be uncomfortable, so it's going to be very gentle to start off with. But there's certainly going to be swelling around that time. But as I say, we don't routinely have a practitioner that we work with, and we don't routinely kind of recommend it or send people to it just because there is a cost associated with it, and I don't know of any long-term evidence to say that long-term you're going to have a better result from it. Although you might say, well, I'm happy just having a short-term benefit, and I'm happy to pay for that short-term benefit. Okay, well, fine. But I don't know. I don't have a lot of experience of it, so I don't feel that I can say yes, it's really good. I certainly can't say yes, it's very bad, because I haven't heard bad things about it. But I don't know if it's the problem with us. You got sometimes, especially in the cosmetic world, I feel like you've got to kind of bridge a bit the gap between the doctor and the science and everything, and just kind of helping people and giving them advice. And I think sometimes as doctors, we maybe are a little bit giving people a disservice by being a bit too much like, no evidence for that, cannot recommend that at all, which I've just been with the lymphatic drainage question in hindsight, because sometimes I think it helps, like when people want to massage scars, we say, look, use whatever you want. We got some stuff, we got some QV cream and stuff we sell, but you don't have to use that. You can use Nivea E45, whatever. There's no evidence to say one's better than other. From a kind of medical point of view, that's kind of good. But is that good from a patient point of view? Is it better to say to the patient, what you've got to do, you've got to massage it 3 times a day in this way, and we've got to use this QV cream we've got. It's actually brilliant cream. It's fantastic. It really helps to moisturize that scar. And, and if we're a bit more positive, rather than being no evidence for any cream being better than another, I wonder if I should have done that with the lymphatic drainage question. Well, we don't offer it, but yeah, probably do. If we start offering it, probably have to be more like that to say, like, yeah, it's really good. But anyway, just reflecting on my own inadequacies there. So thanks for that, Nicola. So yeah, go for it. And if you do go for it, let me know how you get on. But no, we don't routinely recommend it. But that's probably more out of ignorance is the wrong word, lack of knowledge, than any knowledge to the contrary, like that. Because like everything kind of doesn't work until it's been proven to work. Nothing works. The default position is like nothing works until you prove it works. And that's where I am with this. Someone saying, oh, you got to have this, you got to have that. I'm like, okay, well, it sounds good. Sounds nice. But can you prove to me that it works? Can you Can you get 100 patients and lymphatic drainage half of their abdomen and not the other half, and say that they're going to get a better, you know, you can't, can you? You're never going to get that kind of proper randomized controlled trial, which is what kind of doctors are looking for. But, you know, maybe as a patient, you don't really, you're just happy to have something that might be beneficial, kind of thing. And as long as we put it like that, it might be beneficial, you might say, oh, well,